Good afternoon, friends. We are going to have some interesting, kind of insightful thoughts about the present epidemic of respiratory problems that we are seeing right now. We got a cute admirer and an observer, Abhirami, with us. She wants to share some of her concerns with me, and I'm going to be very, very informal about how I'm going to explain to you about the issues that we are facing right now.
Good afternoon, Uncle.
Good afternoon.
So I have been to Uncle's clinic for almost a couple of weeks. So the most of the patients we see have trouble in breathing and then cough. Uh, I mean, like this is the major problem with all the patients who come here. So why is it happening? What's the reason?
Uh, well, number one reason is I have a respiratory practice. My practice is asthma allergy practice. So everybody who comes here has got some issues with breathing, either breathing problems in the upper airway or breathing problems in the lower airway. That's one thing. But right now we have lots of cases with respiratory issues because of the season. If you ask me what is the reason, I would say the reason is season.
Okay.
I'm not trying to sound like a fashion, but the real reason is the season is changing. A lot of people have got seasonal allergies. People who have got seasonal allergies, they tend to have problems when they have rain. The rain brings increased humidity, and the increased humidity brings lots of mold spores. People who are allergic, they tend to react to mold spores, and they start having bronchial spasm, bronchial swelling, secretions, and cough, and breathing difficulty. So, to answer your question straight, we do see an increased number of cough and breathing issues now because of the seasonal factors. But something more important than that is, we need to talk about the role of vaccines in preventing such things. You have any idea about what vaccines are about? What is it supposed to do?
Uh, to like a prevention
Absolutely, absolutely, yeah.
to protect yourself before any
Yeah,
flu or
you have heard this expression, Avi. An ounce of prevention is worth a pound of cure,
okay.
right? A stitch in time saves nine. There's so many things, right? But people don't seem to realize. We have been kind of reinforcing patients that flu vaccine is very important, and pneumonia vaccine is very, very important to prevent you from having lung infections and also preventing flu infections. The flu shot that we talk about, it covers two things. One is general flu, the influenza type A, which is all over the world. You'll be astonished when I say this. You know how many cases of flu are reported in the whole world every year? 1 billion. 1 billion cases of flu cases are reported, and nearly 500,000 people die of flu related complications, mainly pneumonia. So, coming back to this flu issue, this flu is eminently preventable with just a single shot once a year. We call it a flu shot. It covers influenza A. It also covers the H1N1, which is swine flu. So you got a dual protection with one injection once a year, and I have really no reason to even double guess what keeps these people away from getting the flu vaccines. The way I look at it is, okay, the price factor. Previously, the flu vaccines were manufactured in China, and it was costing much less, less than 1,000 rupees. Now these flu vaccines are coming from Switzerland and other places, European countries. Obviously, Europe, the cost is high. It costs a little more than 2,000 rupees, and we have taken an initiative now during Dasara. We are going to give a discount of 500 rupees and offer at a discounted price for all the vaccines. The reason being, the flu, if it attacks you, it's going to cost a lot more money. Yeah? You may need lots of blood tests. You may need an X-ray. Some of them may need a CT chest. Some of them will need hospitalization. They will need extensive treatment for 7 days or something like that. So you're talking about a cost that is running into several thousand rupees, and there is always a risk of death, disability, long-term problems once you have flu. So I keep on reinforcing people, please, when it comes to protecting you from diseases like flu, you be proactive. Don't worry about spending a couple of thousand rupees and then protect yourself from a major health catastrophe, I would say. Can I give you an example, Avi? Recently, just last week, I got a video call with a patient who called from Mecca. This lady has gone to perform her Umrah, and she was in Mecca, and she became very ill. She got the typical flu symptoms. She got fever, body ache, cough, sore throat, runny nose, all the things. It's imperative that everybody who goes to Mecca, either for Hajj or the Umrah, or any place where there are going to be lakhs and lakhs of people assembling, you need to be protected from flu.
Sure.
Okay, this lady did not bother to consult me before going to Mecca. She called from there, and then I suggested some treatment. The next thing I hear is she could not continue her stay. She became very ill. She was transported in a flight to Chennai, and from the airport, she had an ambulance that took her to a private hospital because she got influenza and then complicated by a pneumonia. This is just last week. This is just an example. What I want to tell you is, don't take flu lightly. That flu can be very influential on your health. It's not just a flu, it's very influential flu. And that answers most of your questions, I guess.
So,
Go ahead.
why do you think people are not getting vaccines? Do you think it's because of the vaccine phobia or vaccine hesitancy? I'm not sure about the right
Yeah.
term, but
Whatever term you want to use, Abhi, vaccine phobia, vaccine hesitancy, I think it's born out of ignorance. People, they don't think preventive health is very important.
okay.
And sometimes I also feel that it is the mind block, the mental block. See, after the COVID vaccination, a lot of people had a lot of issues. Okay?
Yeah.
But any health issues that came after the COVID vaccination, they attributed to the vaccine. It could have been the disease itself. Even the COVID itself can cause death, disability, it can cause a lot of problems. You know that, right?
Yeah.
But a lot of people, because of the media, the way everybody, all the illiterates were talking about the effect of vaccine, they attributed, even road traffic accidents were attributable to COVID vaccines. So there is a vaccine phobia that set in during COVID times. And I think that continues. A lot of people are still not out of their home. They have not mustered the courage to come out, go to the doctor's office for health checkup and have the proper vaccine. There are more people who have died of heart attack, renal failure, bronchopneumonia and everything during COVID times rather than COVID itself. COVID killed a lot of people, I agree. But you have to understand, during COVID time, people ignored their health. They were focusing only on COVID,
Yeah.
and they ignored everything else, and the hospital beds also were not available for them. So a lot of people died because of that. And even after the COVID is gone, and when we are encouraging people to come out, have health checkup, have the vaccination, they have not come out yet. They are still in the COVID isolation at home. And this video I'm telling today, it is mainly to reinforce the fact, drive the fact home that please shut off the fear of COVID isolation and other isolations. Just come out in open, come to the clinic, have your vaccine, and don't get kind of a disillusion with all the wrong things that are being done by the media about the effect of vaccines and other diseases. I will quote Bharadiyar. ஆயிரம் கோடி படைகொண்டு வந்தாலும் மாயையே நீ எந்தன் சித்தத்தெளிவனும் தீயின் முன் நிற்பாயோ மாயையே, which means for people who are very well versed in Tamil, I'll translate this. This says that the superstition is the main enemy, you know, and wisdom, knowledge, the proper information about anything is the ultimate weapon to break and win over superstition, even if it comes like a big army. That's what Bharadiyar says. So I want to tell you, people have to get the courage, come out, have the vaccines, and know that the vaccine is going to be protective of the illness, and they're going to protect the life also. That's very important.
That was very nice. I just wanted to know the take-home message of all this.
Well, the take-home message is basically a sum up of what I told you just now. Please be aware of the fact that vaccines are important, and once a year vaccine should keep you away from flu, swine flu, and all other related problems for a long time. One more important point, that will be my take-home message. Once you get flu or any other infection, viral infection, what happens is your immunity goes down. And then you become susceptible, you become vulnerable for acquiring some other infection which is not related to flu. You can get a totally different bacterial infection or fungal infection or something because your immunity is down due to flu. So, by taking flu, you are also protecting yourself from many other diseases. Even during COVID, they were telling, you know, if you're protected against the flu and pneumonia also, the pneumococcal vaccine for pneumonia, once you're protected, you are also kind of escaping from so many other illnesses that are brought on to you because your immunity kind of dips down to a low level. So, friends, I think the most important thing is just throw off your hesitation about the vaccines. Please do come and we'll try to accommodate you. We understand your problem. We also understand your financial concerns. We are not commercial. We are here to make sure that all of our patients are well protected. So take this message very seriously. I really appreciate this opportunity of interacting with my child Abhi, and I hope you enjoyed that.
Yeah, I really did.
Thank
you
you.
so much.
Thank you.
Thank you.